want to start by expressing my gratitude for all of you guys being willing to join this conversation and participate in this with Zivian Health. I'm very honored and proud to be in this room with this particular group of women, and I'm excited to hear about the stuff that we talk about today. My name is Kitty Voelker, and I'm the Executive Director of Account Management at Zivian Health. And as you all know, Zivian is a health tech organization that helps organizations like you guys expand and grow, and with the goal of increasing access to quality care, most importantly. And I'm proud of many of the things that Zivian does, but what I am most proud of is our support of women's health and the full spectrum of women's health, which is represented by all of you on this call today. So thank you for being here, and thank you for being willing to talk to Zivian and the larger audience we're trying to reach about these really valuable issues. I would like to take some time for each of you to kind of introduce yourselves and tell us a little bit about the organizations you're here representing. Alicia, I'd love to start with you.
Sure. Alicia Jackson. I'm the CEO and founder of Evernow. We're a digital concierge service focused on women's health, in particular perimenopause and menopause. So we provide very personalized care for women going through perimenopause or menopause, typically starting anywhere from 35 all the way up to women in their 70s. We do longitudinal care, video, asynchronous, insurance or cash pay, very flexible platform, and real focus on women's health, because we do feel like it is not only just the largest market in women's health, but one of the most unaddressed. Unfortunately, there just aren't enough physicians who are trained in how to recognize and treat menopause. And then there's just a lot of challenges with getting access to affordable care.
Thank you so much for that intro. And a lot of our subsequent questions kind of focus around that point, and in particularly perimenopause. So I'm really excited to hear more about that. Jillian, I'll hand it off to you.
Hey everyone, I'm Jillian Lopiano. I'm an OB/GYN physician. I have had a lot of different roles and jobs over the years. Most recently, I'm working as a laborist at Jackson Memorial Hospital in Miami. I recently moved here. And I also work with Wisp, which is kind of who I'm here with today. Wisp is an online telemedicine company that provides a lot of different healthcare services for both men and women. More for women, we do everything from contraception, and we're just starting to get into a couple of other different spaces. But we do contraception, vaginitis treatment, all kinds of things. And so I signed on with them couple of months ago as their chief health officer, and I'm working with them a little bit on our clinical side.
Thank you. Sam?
Hi, everyone. My name's Sam Bader. I'm the co-founder and CEO of What to Expect Care. We are building a virtual care company for expectant and new moms in partnership with What to Expect When You're Expecting, which is the world's leading pregnancy brand. The franchise has sold 45 million copies of the book, and there's around 12 million monthly active users on the What to Expect app and website. And my co-founder is actually the author of the book. Her name's Heidi Murkoff. And our mission really is to revolutionize access to high quality maternal health care for moms and babies across the country. We plan on accomplishing this by standing up a virtual care platform that will be staffed by OBs, nurse practitioners, newborn care specialists, lactation consultants, doulas, and therapists.
That's really, really exciting. I think every pregnant mom has received a copy of that book and read it. And I know they have a dad's version now, which is pretty cool too.
Yes. It's the Bible.
It's the Bible. It is. It really is. And
even if you're a board certified OB/GYN user.
Yes. Gabby, what about you?
I'm Gabby. I'm a partner at Crosslink Capital. Crosslink is an early stage venture capital firm based in the Bay Area. We've been around for about 40 years, and our core focus is investing in category creating enduring businesses at the earliest of stages, seed, Series A. I've been with the firm for a little over the last decade, and I launched and run our digital health practice at Crosslink, and we've had the pleasure of backing some incredible companies, one of which is Zivian Health, where I sit on the board, and very grateful for the opportunity to be here. So thanks.
Thank you. Again, thank you all for being here. Some of y'all alluded to this in your intros, but I think, most humans are kind of informed by their personal experiences when they, align with or start or, work on a mission-driven and mission-oriented company. And so I would love to hear kind of some of your history, your personal history, and like what led you to start what you did or become what you became, and what led you to where you are now.
I can go first if you like, Kitty. Interestingly enough, even though I work on perimenopause and menopause, my journey started in the fertility realm. That came from two different areas, which is I was trained as a PhD out of MIT, always been very deep into technology and leveraging it really in order to change the future for people. And I had my own fertility journey with everything from egg freezing, embryo creation, and ultimately IVF for my third child. But along that journey, I got very deep into fertility, and the flip side of fertility is often menopause, which is the decline in fertility occurs due to ovaries coming to the end of their active lifetime, leading to perimenopause and menopause. And I still remember the first time I read about perimenopause and menopause and thinking, no one has ever spoken to me about this. My own conception was, this doesn't happen till like 65. Was stunned to find out the average age in the United States is 51, with symptoms really starting as early as your late 30s for many women in their 40s when they start to really feel the impact. And then every woman I spoke to around me just said, can you please do something here? And seeing my own mother go from doctor to doctor and get conflicting and wrong medical guidance from her OBGYN, her cardiologist, her PCP, in many cases either being out of date information or conflicting information. And then speaking to my own physicians and hearing them say, yes, please do something about this space because it is a backwater of medicine. It's very under-researched. The best and the brightest don't go into it. The reimbursement is poor here. And all those things converging to, yes, I thought I was going to do fertility, but in fact, the flip side, the opposite side of the coin is really where we need the focus. And many of the things we're now thinking about for menopause or perimenopause do impact women's fertility.
Thank you so much for sharing that. I too learned the word perimenopause when I was struggling with my own fertility journey. So I think that is very inspiring and something that is very, not talked about and not, the knowledge is not spread widely. It's starting to be more so, which I think is very hopeful, but I had not heard that word until I was trying to get pregnant too. So thank you so much for sharing that. Jillian?
I can take us over into the obstetric side. So and just a general kind of women's health, bird's eye view. So, when you do medical school and you do residency and you do all this training, you really come up for air, in your mid 30s. And I was really blessed that I, didn't have any fertility issues and I have two beautiful children, but all that to say, you sort of come up for air, you're out there, you're practicing, you're doing your shifts, you're doing your private practice, whatever it is that, sort of you've chosen to do an OBGYN, and then you have your own kids. And it really changes the way that you look at how this is all going, right? How we approach prenatal care, how we approach labor and delivery, how we approach contraception, and routine bread and butter GYN, everything from yeast infections to herpes treatment to STI treatment. All of this kind of rolled into, you start to look at this with a different lens as someone that has now been through all of that, right? Both as a young woman and then transitioning into labor, delivery, having kids. And I think in the process of that, when I found some, just personal and professional time and space to like take a breath, kind of what I had been thinking all these years as you're going through it is there has to be a better way. Like as physicians, we're out there, working so hard and you sort of feel like you're on a hamster wheel, not doing as much as you want for patients. And sort of this thinking there could be a better way. Well, once you sort of get your professional life under you, then I started to look at places and people and thinkers and innovators in the space of how we can do things better. And so that's really how I kind of came to this, working in telemedicine and working with different companies. And because there really is so much of a better way to provide healthcare for women. It's not just go into the office, see your provider, or go into the hospital and deliver your baby. There's so many wraparound services. There's so many other ways that we can help. And so, my goal over the last couple of years is to really connect and work with these innovators and and thinkers in this space.
Yeah, I'll go next. So I've spent my whole career in healthcare. I went to Wharton studying healthcare management, then started my career in investing, actually, at a hedge fund, investing in public equities of healthcare companies spanning healthcare services, specialty pharma, med devices, and more recently, digital health. When COVID hit, it was really the boom of digital health, so I made the transition to venture. I spent, the last 3.5 years in venture capital, first at Northwell, and then more recently at Morgan Health, which is part of JP Morgan. And that's where I got to learn all about women's health and the big problems that we have in maternity specifically. And I have 2 young kids. I had back-to-back pregnancies during COVID, so personally very passionate about maternal health. And I learned about just like the atrocious outcomes in the US, like how our maternal mortality is 3x other developed nations. A third of our counties don't have access to an OB. 50 or so labor and delivery departments are shutting down each year. And the racial disparities are enormous. So I made it my personal, mission to find, a company in this space and to invest in on the VC side. And what I found across the board is that, and this applies to, I think, most of digital health, is customer acquisition is extremely challenging. So expensive to, promote your brand and get people to actually engage and, keep them on board. So I thought to myself, I think, a good solution here is to go to an existing community that's already been established rather than having them come to you, right? Like you're leveraging an existing community. And I thought about what I used during my own pregnancy, and it was the What to Expect app. I was on that thing probably 5 times a day. It was the midst of COVID, so I was constantly checking it. And there's a huge community on there, around 175,000 people in each monthly birth group. And it logs around half of pregnancies in the US. So that's when I reached out to Heidi, pitched her the idea of standing up virtual care to her existing community. And she was fully bought in pretty quickly. And we then started, brainstorming ideas and started asking the What to Expect community what they were seeking.
That's interesting. So you said you asked that you sort of got feedback from the existing community. What did that feedback look like?
So there's a bunch of gaps in traditional maternity care. I'll talk about a few of them. So first is the first trimester, when, in the Medicaid population, women are not even going to see their doctor for the first time until 12 weeks. That's, an entire trimester has gone by. So we plan on filling that gap. The second gap is the on-demand nurse hotline, which you would think exists for most people, but we've surveyed and polled community members, and around half of people don't have access to that. I had an instance during my pregnancy where I thought I was spotting, I thought I was having a miscarriage. I called my doctor. I didn't hear back for 3 days, and I was in New York City. So that was super eye-opening to me. And then the final gap is postpartum, when 40% of people don't even go in for their postpartum, check-in with their doctor. And there's huge issues accessing specialists like lactation consultants, therapists, doulas. Mm-hmm. For the most part, they're not covered broadly by insurance. So we plan on filling those gaps in care.
That's really awesome and really inspiring and exciting to hear. Excited to hear what comes from that. And I think it's really interesting that you source the existing community for what they need. The direct path to that is so valuable.
Yeah, we're leveraging data and building what the patients are seeking.
That's awesome. And what about you, Gabby?
Yeah. So kind of to start with my personal interest in healthcare, I've had, I've seen family members and people close to me over the years have, being fortunate enough to have access to some very transformative and game-changing technologies and, that have either cured them or, helped them live comfortably by having access to care. And, when I became an investor, I saw, I looked at the numbers and saw just like how, drastically underfunded digital health was. We've backed a bunch of, when I joined, we had backed, a bunch of founders building, companies in other sort of, foundational industries like financial services and retail. But you look at, digital health over the years and it's just, multiple years behind those categories. So I definitely saw an opportunity to, at the earliest of stages, find and invest in founders that were building really interesting stuff. I think, what excites me is just, if I could be the smallest part of, investing in, some of these companies that are really transforming the, health of the population and access to care. That's really exciting to me.
Pivoting a little bit, obviously at this moment in history and in time that we are in this country, barriers to women's health are top of mind for most women and hopefully some men as well. And I would love to hear from you guys what the strongest or biggest threats and biggest barriers are, and more importantly, what your organizations are doing to overcome them, especially at this time that we find ourselves in.
I can start. One of the things that as a provider has really difficult for me, and as kind of an advisor or CH or consultant, for various different things, is the rise of misinformation about all kinds of things in women's healthcare. So everything from use of home remedies for a yeast infection to misinformation about contraception, which is a really, really big one, to mis and disinformation about pregnancy and abortion care. And it really runs the gamut. Menopause space, similar. And so that is something that is deeply concerning to me, because we already have these gaps in care that we've kind of discussed, and to have to undo misinformation in an already existing system of mistrust towards doctors, which is a problem in and of itself, right? But to try to dismantle misinformation on that foundation and then sort of teach or, regain that trust and re-talk about what is evidence-based and what is medicine and what is science, that has been a really big challenge for me. And a lot of it is based in restricting women's access and restricting a lot of aspects to women's healthcare. And it's pretty concerning on the provider side.
I'll take a slightly different viewpoint, but also maybe build on Jillian's comment, which is, rather than call it misinformation, which I think can be somewhat it makes it very political. And I think one of the challenges with healthcare right now is how political it has become. When I think you ask anybody, everyone cares about healthcare and wants our families and our partners who we love to be healthy. And I think there's been a real conflation too around science equaling truth. And, as a PhD, science does not equal truth. It equals the best evidence and data we have at the moment to support a hypothesis. And so there's a lot of nuance around everything in medicine, and medicine does not equal science. It's the application, risks versus benefits, even in menopause, when we're even around things like mammograms. Everything has nuance around it. And I think, unfortunately, given that we don't have enough medical providers have a very short period of time to spend with women, often less than 10 minutes. You can't go into the nuances and help educate and inform a patient, a woman, on those nuances and on all the risks and benefits so that she's empowered to make a great decision. And all this rolls up to, in the end, one of the biggest challenges in healthcare today is we simply don't have enough healthcare providers. Mm-hmm. And reimbursement is often not enough to support a provider spending enough time with a patient. And I see so much of this just rolling back to that. And that's why I'm so bullish on telehealth and online care mm-hmm. and asynchronous care, because you can bring a lot of technology to bring a lot of leverage and support to providers. So if I actually have to name the biggest access to care, it's not enough providers, not enough reimbursement for women's health. Full stop.
Yeah. And I'll add on to that too. Like in maternity, the geographic barriers are huge. Mm-hmm. Sometimes women are driving 2 to 3 hours to their nearest doctor. And as a result, they're not getting prenatal care. So definitely agree that telehealth is a way to reach those underserved rural populations. Another area I'd like to talk about is just stigma, mm-hmm. still related to mental health and substance use disorder. Is a really big problem. And I think people or women are generally believe that pain is normal. So a lot of the times in maternity, things like pelvic floor issues, like people don't fully understand or are not educated about it. And they believe that, I'm having pain, like this is standard, this is normal, there's nothing I can do about it. And similarly with mental health, mm-hmm. postpartum period.
Yes.
And just to add something on to I completely agree with all that you guys said on the misinformation and just, biases amongst diagnosis, what, gets us excited too from, is just AI driven diagnostics and, developing tools and that are going to reduce these biases in diagnosis and treatment so that, women get more accurate care. So, I'm hopeful for, seeing the tools that come out, in this sort of big wave of what's happening in AI.
We are too. And one of the questions that we had sourced from some friends and family, we wanted the patient or the potential patient's voice to be heard in this conversation too, was based around kind of social media, right? And when you're pregnant and things you're watching and the fear it instills and how these how can these organizations sort of combat that? And I've looked ad nauseum at Wisps and Evernow and all of and I think that strong presence really goes a long way to combat the others. And so I think that's a really awesome thing that your organizations are doing, because unfortunately that is where a lot of people look. Where people look for information, and y'all combating that by having those strong voices on those platforms is really powerful, at least from what I've seen. So I appreciate that your organizations do that. Okay, so shifting gears a little bit here, not really though, actually, so we were just talking about the role of technology, but how do you see the technology transforming women's health in the next 5 years, and what transformations, innovations are you guys most excited about?
I can start. I would say on a couple different fronts, which is really what I spoke about earlier in terms of being able to use technology, AI, machine learning, clinical decision support to really help leverage each individual provider's ability to serve women and serve far more women than they would be able to do with kind of a traditional one-to-one kind of encounter. So definitely there. Speaking to what Gabby spoke about earlier, which is using AI in terms of diagnostics, looking at different profiles, making sure the right care gets to the right woman with the right diagnosis and the right treatment that's going to work for her. I'm super excited about the fact that unfortunately women weren't required to be included in clinical trials until 1993, 1994. And so we have a huge gap to make up for women here. We have so many disease diagnoses, so many treatments, pharmaceutical treatments that have all been designed for the male body, but not for the female body. I think what's exciting and the thing we're doing at Evernow, which is when you have these online platforms and this ability to really collect data at scale in the real world, you can think about almost running real world evidence trials of a very broad population, hundreds and thousands of women across all different types of backgrounds. Look at treatments, look at how those symptoms resolve, look at outcomes. And so we've built now the largest database on perimenopause and menopausal women. And now we're publishing that data and putting it out into the field because unfortunately, trials are very, very expensive to run. And so what's really interesting about these different online platforms is it's a really new data source and ability to move women's health forward using technology and this new data collection capability.
Yeah, on the data point, just to add on there, I came across to put like some numbers around it. I think it's 25% of the world's data is healthcare related. So there's this like massive surface area to build upon, and most of it's not available like on the public internet. And so like there's just so much data that and like value that can be captured out there by new companies. So that gets me really excited. Is like there's so much data already, but then in addition to that, there's all these new data collection models out there that are really fueling a lot of like what we're seeing in technology and technology's role in healthcare.
Another question that came from a good friend of ours was about NHANES and its vast reaching and incredible impact, but has the implementation challenges that we're all well aware of, and the potential marginalization of subgroups. And given those learnings, where we now have the world of AI and ML, when thinking about delivery and considerations and casting that wider net, like how y'all envision those tools being a part of that. And I think, Alicia, you just spoke to some of that, but I'd love to hear from others about how they envision that and the excitement around it.
Yeah, I can talk about how we plan on using AI. So I think first we're going to use it to just make clinicians more efficient, so that, there could be pre-populated answers to clinical questions with clinical, human oversight and review. But in the long run, I think the holy grail is like personalized AI for diagnoses and treatment. And I've seen examples of this. So I think there is like really promising, opportunity here where the same medical question is answered differently depending on the person's medical background, medical history, and pulling in their EMR data. And I think that could be really, really compelling and, just a huge game changer.
Jillian?
I think, and we're already seeing, this is particularly true at Wisp, I think we are seeing not in an AI way, but just even pre-populated forms to screen for contraindications to estrogen, right? So for contraception. So even that, right? Like the most basic that used to be a 20-minute visit, you getting someone in an office, getting them like using an MA, using all of these resources to ask a couple of simple questions to screen for safety, contraindications to estrogen. We're now just using, like, even that's not even AI. That's just a pre-populated form. Even that, in my clinical experience, to go from my intern year to how many people I could provide contraception to in an hour to what I can do now, even with that, even without AI, is massively different. So thinking ahead to what that could even do is pretty cool.
It is very cool. So speaking, like, again, more for like from the patient's lens, what strategies in your eyes can women adopt to advocate for their own healthcare in a system that, as we've all acknowledged here, often overlooks their needs? Like, what advice would you give to the everyday woman about how to navigate that?
For me, I think health literacy is super important. And so I think that these resources, and I think a lot of the What to Expect, the Wisp, and Evernow, all of this there is a foundation there for providing some degree of health literacy, right? Of education, of this is what's going on. No one's explained this to you. Let's start there. Let's explain this process to you. And I think that is a really important foundation. So, no, there's different ways to do that, but showing women how to seek out the most evidence-based, the most, comprehensive, the most education-based health literacy information out there. And there's a lot of different ways to do that. I think it speaks to the difficulty of customer acquisition, right? You've talked about that, like how do you get people in? And so I think something that could be done with existing brands is, right, like making sure that health literacy is on point. On an individual level, a lot of times I will direct women to resources that I think are useful and helpful. And I think that's being done more and more, again, as we're sort of combating a lot of difficulty with misinformation out there. And so providers are that's a learning curve for us, right? Because we haven't always had to do that, or haven't always thought about it. So I'm directing women. I also think that apps are incredibly important. I mean, we've already talked about this, having an app, so cycle tracking, body metric tracking, your, information about like your own self and your own individual symptoms, needs tracking, and then working with a provider on that. It's hard for a provider to have those conversations if you're not sure, right? And so using apps and using your own data to track and talk to providers is something that I'm pretty big on as well.
That's a really good point.
I think one thing that we speak to a lot of women about is you really do have to be the CEO of your own healthcare. You can't expect people to solve it for you. No one's going to bring up issues oftentimes unless you do. So you really do need to come prepared. Think about it as hiring your healthcare team who's going to advise you. To as much as possible, if you don't feel comfortable with a provider, seek another one out. I know that isn't always possible, but if it is, vote with your feet. Online resources tend to be great. So if you can't find an in-person provider, so many things you can now find online. So there's so many different resources across different phases of women's health that I highly recommend women go to. Often these are forward-leaning organizations. They do have to stay at the top of the field. Unfortunately, every physician is a product of when they went to medical school, their own experience, and how much they've stayed up to date about different things in the field. And so it's not that anyone's not trying to give you great care. It's just often physicians, if they don't know a certain area, they don't feel comfortable practicing in it, they're not likely to be your best person in that space. And so sometimes you have to find people who specialize in perimenopause, in PCOS, whatever it might be. Go find somebody. You can ask them how they stay up to date in it. And then speaking to Jillian's point, come prepared. Here are the symptoms I'm having. Here's when they occur. Oh, they're occurring cyclically. They're not occurring cyclically. And so coming prepared, sometimes you have to do things. Well, I really like to try this treatment. I'd like to try this thing. Let's just try it for 3 months. That tends to be magic words with a lot of physicians. Let's just try it for 3 months and see how it goes. And so there's just a lot of self-advocacy and understanding how to work within the medical system that you need to do.
Yeah, I totally agree with that. And I think diagnostic tools and screeners are also really important. And, that would allow women to advocate for themselves. So what we plan on doing is distributing a pregnancy wellness quiz early on in pregnancy, literally right after they take they get the positive pregnancy test, so that they can understand their risk factors on day one. For things like preeclampsia and gestational diabetes, a lot of these things can be the risk for these things can be massively reduced if you take interventions early on. People just don't know. Apparently I was at high risk for gestational diabetes because my mom had it, and I didn't even know through the entire pregnancy until afterwards when I was learning about it through, my research in the space. But there are so many things that I think can be, flagged early on in someone's healthcare journey.
That's a really good point. Gabby?
Yeah, I mean, I don't have much to add besides I think having this data literacy, and I love what you said, Alicia, and be the CEO of your own healthcare. And so, using the tools and, services and education, solutions out there just to really understand your data and have really deep informed conversations with providers. So yeah.
Yeah, there's a great example, Sam, that you just kind of jogged my memory about this. In terms of preeclampsia, there's a lot of great programs out there, and it's a great example of being literate, right? Knowing your risks and knowing your own health data. So there's a couple of programs out there, particularly for low-income, low-resource women, providing either home health nursing or even just a home blood pressure cuff. And the data on it is being generated, but these programs are incredibly successful. And just from a boots on the ground perspective, we're seeing more and more women measuring their blood pressures at home in pregnancy, in postpartum, and coming in and saying, you told me this number was worrisome, so now I'm here. And that's something that really didn't happen a long time ago. And so I think that some of these hypertension programs for women, for pregnant women and postpartum women are a really beautiful example of that.
That is an amazing example of that. Thank you for sharing. Kind of as a follow-up to this question, a lot of women ask when we were doing some sourcing and asking around, what can they do, not only for themselves, but to advocate on a larger scale for the things we're talking about on this call, to be an advocate for women's healthcare rights, et cetera, what they want to do more, and what advice would you give, and how would you suggest that they do that in a most effective and wide reaching, but also educational way?
I think the biggest thing is to talk about it. I know that sounds so small, but as we spoke about earlier, there's a lot of stigma around different areas of women's healthcare, things that we don't want to talk about, we might be embarrassed about, everything from painful sex, bladder issues, UTIs, pain in general. And so if you don't talk about it, women often feel like they're the only ones who might be experiencing it. It's something we hear all the time from our patients. People feel very alone. It's not something they want to talk about. And at the same time, so many of these things can be addressed. You can get great care. You can feel better. But if you don't talk about it out loud to your friends on social media, it doesn't unfortunately get risen to the degree it should be. And people think they are the only ones when 80 or 90% of women might be experiencing this same thing.
Agree. I mean, I think I wouldn't say this right often as a physician. But I mean, and Alicia, you touched on women's, like, a lot of this is politicized, and I mean, it shouldn't be. Like, quite frankly, there's no other area of medicine where we talk about what a cardiologist is doing. I don't know of any cardiologists that have to ask the government what they should do with their patients, right? And so encouraging women to be, unfortunately, right, politically literate and active. I'm in Florida right now. I'm in Miami. There's a ballot initiative that could drastically affect the healthcare of all of my patients. Every woman in the state of Florida. Do most women know about it? I don't, you know what I mean? I don't know. I'm new enough here that I'm not sure what the temperature is there. But I think that being engaged and active and understanding, listen, we're all strapped for time, but in even the most basic way about the laws that are being made, how your local senator, congressman votes, how your representative votes, how, what is happening, what is being legislated about your healthcare. In both positive and negative directions, there's some really wonderful initiatives that are going on for especially postpartum and maternal health care. And a lot of people advocating for the Momnibus bill and all of that. So being engaged, or at least being aware on both sides of the efforts that are being made, both positive and negative, I think is incredibly important. And I always encourage, at least friends, family, colleagues to do that.
One other area could be, just encouraging more women to get into venture capital and entrepreneurship, because the numbers are, way too little. I think only 13% of VC partners are women. Only 2% of VC funding goes into women-founded companies. And I think if we were to boost those numbers up, like, we would have way more advancements in women's health.
I'll double down on that and even say, even just beyond venture, there's a lot of different ways to build companies that don't require venture capital. There's a lot of different ways to get financing, all the way from bootstrapping to debt capital to PE. So it's not the only place. And just having more women opening up their pocketbooks. There's lots of different ways to fund women's health. Use everything from a donor advised fund. There's a lot of crowdfunding sources out there now. And so it doesn't, this is how things get done. Women starting companies, starting initiatives, and other women supporting them.
You're absolutely right.
And you guys are all on, kind of like more in that space, where for me, I will triple down on it from the opposite perspective of, we don't learn this stuff in medical school. Like, we don't have that education. So those of us who are sitting there thinking, like, I could do better, I want to do better, a different way. But then how do you connect? And I just think that having women entrepreneurs and venture capitalists and some sort of guidance for someone like me that has all this medical background but doesn't know quite how to connect to this space, having other women around to, work with is amazing.
That was a very, very powerful answer, and I completely agree. So essentially, we all need to start more women's healthcare businesses, is my takeaway. I'm going to get working on mine. Gabby, I kind of wanted to, we've sort of covered this, but I wanted to target a question to you as an investor. And Sam, like, given your background, you can probably speak to this as well. But how do you look at the segment of women's health stratifying opportunities in that segment compared to the broader investment strategy, like, category?
Yeah, I just think about it like healthcare, and I think sometimes it gets bucketed from when I see companies go out and raise and go, pitch to venture capital firms, and they do healthcare, but then they put women's healthcare into this like sub-segment, and like, I think that shouldn't be the case. It's incredibly important, and it shouldn't be sort of like narrowed into this bucket, because it's massive, and like the addressable market is so big, and we've just scratched the surface of it, from just the company formation and from like venture capital dollars into the segment. And so I try to, I just try to broaden the aperture there and encourage people to think about this as healthcare, and because that's exactly what it is.
Great point. Sam, do you have any thoughts on that from your
Yeah, I totally agree. The market is huge. I don't think investors always fully appreciate it, especially when talking to investors as a founder. Like a lot of them are like, well, we haven't seen any real exits in women's health. So I think that's a big problem. Like the only public company in women's health is Progeny, and the stock hasn't been doing well. So I think we need to encourage, like, we need to support like all companies in this space, because that I think is the biggest pushback from investors, and VCs are always looking for that billion-dollar exit.
Yep.
Totally.
Well, I'm glad that Zivian is doing our part in helping companies like you guys. I feel very proud of that. Again, as I mentioned, we sourced some questions from friends and family, my mom included, and some of them are new to telehealth, and like some of the older generations have never used it before, and so I wanted to like demystify that experience for them a little bit. And one of the questions that came up was, like if I start in telehealth and then get referred out or have to go get blood work, or how all those things, how does all of that work? Like I think a lot of people of an older age, are a little intimidated by that process. And so I would like to take some time to talk about it and, give them some comfort that it's accessible and doable and probably the best path, in fact.
I'll start just because I don't have to be honest, great answer, because to me, this is an area of where we need growth and where we kind of need, it's a space that has, that needs some work. Because I think that a lot of these services are so beautifully provided for things that are simple, on my end, young, healthy women, and you screen them and you're off. I think there's room to grow for sure, on the more complicated patients. And maybe that's where AI comes in, right? Maybe that's an algorithmic direction. But as a provider, it is super easy, super exciting. You're serving all these people that have, that are low risk. What do you do with the more moderate, the higher, that need a little bit more information? And I think that to me is something, as a provider, I see like an area of growth. And so I don't know, I would love to hear like, the kind of ideas that are being generated out there for that.
Yeah. So we tend to deal with higher complexity patients, largely just due to age. So many of our women who come to Evernow do tend to have other comorbidities, other things going on with them. And I'll talk a little bit about, first of all, one of the really interesting things about telehealth, because you have so much clinical decision support, because you can pull the knowledge of so many physicians and data together, is you really can be world class. And at this point, we are world class in terms of perimenopause and menopause care. It's based on the latest evidence, research, medical guidelines, over 200,000 patient profiles that we have. No physician could ever see that. And so we are in this interesting position of really being on the leading edge of understanding how to treat, care for, diagnose perimenopause and menopause. As far as when you need to kind of integrate with the offline world, we have integrated diagnostics. We can send a script, we can have it uploaded back, we can definitely go through it. We do refer out. We have physicians we refer out to. We can coordinate with your physician who may be in person, or your just care practitioner, whether it's a nurse practitioner or someone else who's in person. I wouldn't say it's that much different from the current world you're in today. I would say the biggest benefit that we've really seen and that we hear from our patients is, one, world-class care. They have a physician or a nurse practitioner who gets it. The fact that you can interact, at least on many platforms, including our own, 24/7. If you have questions, you can text them anytime and we'll get back to you within hours. You could set up a video call. So it's much higher touch care. I agree with Jillian. I think the leading edge right now is how do you really integrate really seamlessly with the rest of the offline world, the in-person world.
Thank you for answering that question. I think that it'll help a lot of people because I think it came up several times when I was talking to, especially, the older generation. So I appreciate that. Pivoting a little bit back to data. So one of the questions we also sourced was how can we address the digital divide to ensure that all women have access to virtual healthcare services? And is there a digital divide in y'all's experience?
We haven't really seen one. I tend to think the divides come in other ways, which is, do you take insurance? Do you have an affordable cash pay price? Obviously we have both asynchronous and synchronous options, but I would say in today's world, most people have the ability to do a synchronous visit, to do a video visit if needed. We see this much more on things like insurance coverage and ability to pay. That's really where we see the divide today, at least in our experience.
Will you speak a little bit more about that? Because that was actually another question that was also sourced. So I would
not everybody has insurance that will cover whatever the visit is. Sometimes you have a very high deductible. So even though technically the service might be covered by insurance, you still have to pay, $50, $100 out of pocket. The way we deal with this is we always have an affordable cash pay option in addition to insurance. Or maybe you take Medicare or Medicaid, and actually that tends to be challenging for a lot of startups to be able to be resourced enough to take. So those are the major challenges there.
I'll just add on to that. Yeah, Medicaid is an area of focus for us because almost half of births are under Medicaid in the U.S. and the challenge is fee-for-service reimbursement rates are very low. So I think in the long run, the way to be profitable on the Medicaid population is to enter into value-based care contracts where you're basically, promising that you're going to reduce costs for a certain population and compared to a benchmark, and you capture a percentage of the savings. Otherwise, under fee-for-service, I don't see a path to profitability under that population.
I think that there's, a digital divide of sorts that will and maybe has emerged just on data diversity. So some of the AI healthcare solutions that are out there, these models are being trained on non-diverse data sets. And so there's biases in them, which are not flagged when the actual solutions is in market. And so I think, there's an opportunity to just build companies, that are collecting data around, women and diverse groups and so on and so forth to ensure that a big digital divide doesn't emerge from having, a lack of diversity in the data itself.
That's a great point and a great idea. Another question we sourced is, what women's health issues do you feel, if not addressed immediately, will cause irreparable harm within the next 2 to 5 years, if any?
I mean, I think the issues that we see going on around rulings on abortion from state to state, and I'm going to give what folks need is certainty. The fact that I know physicians who've had to get criminal insurance coverage. A physician needs to know under what guidelines they're operating, and if it's murky, nobody wants to put themselves at risk. And I think that's actually what leads to the most risk of all. So I think clarity on the legal front is probably the hugest risk that we have today, so that women can get life-saving care if they need it.
Agree wholeheartedly. That by far is the most dangerous. And sort of the current brewings of plans of legislation that could restrict fertility care, contraception, in addition to abortion. So, because all of that's coming. So that's that one. And then I would also say too, top of mind is the maternal health crisis and the maternal mortality rate in this country, especially for women of color, is just especially the disparities of particularly low income states are pretty drastic and getting worse. And so I think those two go hand in hand. Those don't exist in a vacuum. That, control over your reproductive health, given the risks of pregnancy, then sort of, feeds into that. So both of those are definitely like top of mind for me.
Sam?
I don't have anything to add. Those were great answers.
Yeah, I was just going to add like around some of the workforce challenges and, labor shortages and, stuff like that is all I would add.
I'm from Louisiana. And so one of the questions that came from one of my dear friends there is that like, when, in living in one of those states, she asked, like, have you all seen sort of like decreased action in those states as a result of the laws and the restrictions on your platforms and in your ability to deliver care?
I don't know specifically about Louisiana, but I know in states with strict abortion bans, like the number of providers has gone down by sometimes close to 25%. So the shortages are getting worse. I think half of Texas's counties are a maternal health desert versus a third for the whole country.
Yep.
So there are definitely access issues. And NUREX just put out a recent report highlighting the results of a survey they conducted showing that people are actually fearful to go in to get their well woman visit in those states, even though it may not have anything to do with pregnancy. So those are just some of the things I've been hearing.
I know, and I actually, Wisp just did a survey about sort of the state of reproductive care, and I don't have it with me, but I can maybe get access to it and send it out to you guys because I think it's similar, right? Similar sentiments. And what I think is, I love that question because it just made me look at things in a little bit of a different way because, when you're a hammer, everything's a nail, right? So I'm living in this space where the emergency care, this sort of really catastrophic consequences of all this are getting to my door. And so that was a really interesting question because it's, well, what are the other ones? What are the sort of more subtle findings?
Yeah, I mean, I know like a bunch of my friends in the state of Louisiana and are afraid to track their periods on apps and like that kind of fear on even the smallest of level, which therefore prevents, harking back to our earlier part of our conversation, like being the CEO of your own healthcare, right? Like if you're afraid to track your own data, it's harder and harder to do that, right? And that's really makes the whole experience of care far more challenging.
Yeah, I've heard that as well. And I've even gone so far as to say, if you are not comfortable, grab a paper calendar, which is wild, right? But that concern is there. Yeah.
Another question that came, and we've talked about this, alluded to this in a lot of different ways, but like, how specifically do you guys use data and this tremendous amount of data that you all have gotten from your customer, your patients and organizations? How do you use that to drive and inform care overall?
We use it in a few different ways. So we have now over 200,000 patient profiles. And it's quite a diverse data set as well. Women, everything from Black women, Hispanic women, East Asian, Southeast Asian, Indigenous women, pretty diverse data set. And we've used it in a multitude of ways. One is getting very clear and more sophisticated on our diagnoses. We do see women of different backgrounds have a different set of symptoms at different stages. We also have quite a bit of outcomes data now as well, and that helps us to tune protocols, dosages, what works well for what symptoms, what medications do we see interactions with. Many of these things having not been published in the literature or even running counter to almost like established medical wisdom, which has been quite interesting to have. We also leverage this. We publish it on our website. We push out the data so women and physicians can be educated. We published our first journal paper in the journal Menopause probably about 6 months ago. We continue to publish that data and push it out. I mean, the place where we can literally have the most impact is if this knowledge not only gets to women, but also physicians and can put it into practice.
Sam, you kind of spoke to this a little bit earlier, but
yeah, so we haven't launched commercially yet. So we don't have clinical data, but we have the data from the users in the app, which is name, email address, due date. So we're conducting some initial customer discovery to pair like those pieces of information with what people are seeking out. And so that's the extent of it today.
Something that I'm because I don't want to bore you guys with the data that we use for investing, but something I'm looking forward to and is just I think a couple of you mentioned just like the customer acquisition just crisis basically. That's so expensive. It's so hard. It just makes everything prohibitively expensive. You need to have a tremendous amount of resource and so on and so forth. And just like the targeting is very challenging. And so I am hopeful that, the amount of data that like all of these companies are collecting will help inform those customer acquisition strategies and hopefully make it so it's not such a, immovable mountain to climb for all these great companies out there.
I think, back to the question about like what can individuals do to help advocacy is share that data, right? Like share the things that y'all have published, share it on their personal stuff and call attention to it within their own communities is another way that we can, reach more people. The final question I had was about perimenopause. And like I had shared, I only learned that word during my own pregnancy, but it's starting to become a word that is now recognized and like a thing that is starting to be talked about. Thank God, right? And finally, but Alicia, I kind of wanted to ask you, why do you think that is? Like, what caused that evolution? And like that now, okay, this is a term people recognize, and that's new. And how did we get there?
I think there's probably two things going on, but I think the biggest one is actually cultural, which is you see Gen X and millennial women who have been much more proactive about their health. They've been using period apps. Maybe they got their birth control through Nurex or Pill Club or now Wisp. And they are starting to hear about this thing called menopause. And then they're like, wait, but things are starting to happen before that time. And so there is this proactiveness. Our biggest demo that's growing the fastest is age 40 to 50, women in perimenopause. They're coming in, they're wanting to be proactive about it. They know that something is off with their bodies. And unfortunately, there is very little medical guidance about this space. Through our own work, yes, people talk about period changes being the first shift in perimenopause, but from our own data, what we also see is that actually those changes can be quite subtle and women may not pick up on them. But what we do see is sleeplessness, anxiety and depression, a lot of spike in mental health symptoms, often coming somewhat cyclically. and then also weight gain around the truncal area are many of the first signs and symptoms that we see of perimenopause. And women, so many women that feel like I must just be super stressed out. I must be, I have kids, I have aging parents. I'm also having work. I have too much going on. But it's compounded by the fact that they're starting to have these fluctuations in hormones due to perimenopause. And it's exciting seeing women want to get ahead of it, but I would still say there's not a lot of medical guidance here. A lot of people will still be told, here's an antidepressant. 1 in 4 women are prescribed an antidepressant. It's insane to me. When a lot of these things can be treated through appropriate kind of hormonal treatment, other lifestyle factors that people can put into place. Women might be told, we'll just take an oral contraceptive, which can work. But also we've had a lot of success by putting women on low dose hormonal therapies, even during perimenopause. It is harder, but it's not quite the hammer of an oral contraceptive pill.
Interesting. I'm personally very excited that the awareness is starting and that people are advocating sooner. And I used to work in the mental health space many, many years ago, and noticed that correlation around that time. It was like when you see sort of an influx of patients around that time. Does anyone have any parting thoughts or things that they want to mention before we get off a point that you think the world needs to hear? Because we want to know.
I'll just start. I think, back to the point just about, the lack of funding and so on and so forth. I think there's a lot of blockers out there, but now's a really great time to start and build companies. And I would just encourage the people out there who are potential founders is, go for it and be very vocal about it. And, I think there's a lot of capital out there looking for great companies to invest in. And so don't let any of the sort of like noise, kind of restrict you from doing what you want. So yeah, I would just encourage the potential founders to, keep building and keep at it.
And if someone is looking into being a potential founder, Gabby, what advice would you give them? Like, where would you direct them?
Yeah, I mean, I think, I would say talk to as many sort of like advisors and like people around you who have their finger on the pulse of, what, what investors are looking for, potential new hires, things like that. And so, just tap your networks as much as you possibly can. I'm always happy to be a resource for folks that are starting companies, and we like to get to know entrepreneurs very early on in their journey. So yeah, please reach out.
The note I'll put on top of Gabby's is that if you are going into the healthcare space, know that it will be harder than your typical SaaS startup or CPG or whatever it is. Healthcare has a lot of regulation. It's state by state. You really do have to get deep in understanding different payment models and incentive models. It takes more work. It is so meaningful to do. It is so worthwhile. Every woman here who is in the healthcare space, I mean, you hear from women every day that like you've changed their lives, you've saved their lives. They're so happy they found you. It is meaningful work. And it is also very, very challenging to build a company in the healthcare space. I talk to my fellow founders in the healthcare space all the time. We're like, why are we doing this? We could have done something so much easier. But at the same time, you have one life to live, and making an impact and impacting every woman, 50% of the world, is a huge market. It's very, very important. You're going to change the future for your daughters, for your sisters. But know that you should do your homework, really understand the healthcare space, take your time. If it's going to take you a couple more months to launch, to do the homework, just do it. It's better to do up front and really, really understand the market, and all the different kind of incentive models that you have in the US.
One other thing I would add is don't be afraid to fail, because now that I'm a founder, I'm realizing like failure is very, very common, but it's not entirely failure. It's a stepping stone, and it's, an opportunity to learn. Another thing I realized is being a founder is all about selling to investors, to customers, whether it be patients or health plans or health systems and future employees to come join you, whether it be, full-time or an advisor. But yeah, that's definitely a key skill set you need to have as a founder.
Yeah, it's not for the faint of heart. You may think, I'll know within like 3 or 4 years. No, most founders are on this journey for 9 or 10 years. It's a very long journey. You need a huge amount of grit. You have to be super tough and able to, as Sam said, go to the brink of failure. Every great company has great stories. I think The Hard Things About Hard Things is a really, really good book. So many companies have the, oh shit, it's over moment that they have to get through several times. So you really do need the grit if you're going to be a founder to get through all those hard times.
I love that you use that word. Jillian?
Sounds like residency.
Yeah. A lot of late nights.
Sounds very familiar. Yeah. No, I mean, I'm grateful and excited to be part of this space. I know a lot of physicians want to be more involved, don't know how. And so just, on my end, trying to be a resource, grabbing people when I can that are, great and that are doing good things and doing the right things and really care about taking care of women. So on my end, I'm trying to do that and still trying to navigate it myself, right? Like all I ever wanted to do was be a doctor and take care of women. And so just finding new and interesting ways to do that has been really exciting for me and for you guys to know, there's lots of great talent out there on the doctor side that are, looking to make differences in this way.
Well, I can't thank you guys enough for this conversation. It's been very inspiring, and Zivian is very grateful to be a small part of the amazing work that all of you do. And thank you for being champions of ours as well.
Thanks, Kitty.
Thank you
So much, guys.